So we are all set to start. So we're going to bring tonight's meeting to order, and I will start the meeting with the chairman's general announcement. The Board of Health is recording. Is anyone else recording?
No.
Alex, Tammy, anything?
Nope.
Okay.
Nope.
And tonight's meeting is being held virtually through a Zoom webinar pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law. So we'll start with that. We are not approving minutes tonight, correct? We don't have those. All right, so we are going to start with public comment. If there's folks here for public comment.
Okay, I have one. Sherry Brady.
Yes, wait just 1 minute.
You can just state your name for the record, please.
Yes, my name is Sherry Brady, and I'm a nurse practitioner and have lived in East Longmeadow for 47 years now. I want to thank all of you for all that you've done for the health and safety of the East Longmeadow residents. And I'm basically, really, I've been to the last couple of meetings, and I just once again want to voice my opinion in that I hope that you will vote for the indoor mask mandate. Thank you very much.
Thank you. Is there anybody else, Alex?
I do not have anybody else.
Okay, so we will move forward on the agenda, given that there's no one here else for public comment. So we have the first thing on our agenda is voting to declare a public health emergency due to the surge in COVID-19 cases. And first, I want to ask Tammy to share us some of the most recent data to really give us a picture of where we are. So Tammy, thank you.
I'll give you a little perspective. So our highest week last winter, which was mid-January, reported on January 28th, our highest number of total positive tests was 198. Last week, our 14-day total positive tests was 424 with 401 positive cases. So that means a couple people might have taken the test more than once at 16.31%. Today, the table came out for the total positive tests, and we are at 692, leaving us at 23.4% positivity rate for the town. So we really jumped up in the last week significantly. So the highest number last year was 198, and we're at 692 right now.
And that's consistent with the community rates as well across Hampden County.
Yep. I don't have any other new data because it usually comes out on Thursday, like the vaccine rates and everything. So as of right now, we're still 68% vaccinated in town, which I'm guessing tomorrow will probably be 68, 69. It probably won't change too much.
So I got more data. If you guys, I have more data that I can share. So hospitalization rate in Massachusetts over the last 14 days has gone up by 96%. The average hospitalization rate per 100,000 is 39, which is the highest it has been ever since the COVID pandemic started. In general, 25,000 positive tests are being found across the entire state for Massachusetts for COVID. And in Hampden County, we had a rate of 28% for positive COVID testing, and that's just the reported ones, not the home tests. We currently have 300 people hospitalized at Bay State with COVID in a 716-bed hospital. And 30 of them are in the ICU requiring ICU level care, which means most of them are on a ventilator. Of those who are admitted, 79% are COVID positive for treatment for COVID. And then 23% are incidentally found to be COVID, and it's questioned whether their primary diagnosis is actually related to COVID or if it's just incidentally found. And the rate that we have currently in Hampden County is one of the highest in the entire country. because our vaccination rate, like Tammy said, is 68%. That being said, we are seeing reinfections and we are seeing some breakthrough infections, but they are very low still, less than 4% total of all the cases. But we are seeing on average, 25,000 positive tests a day, which is again, the highest we've ever seen. And so it's surely a numbers game. Like if you think about it, last year in January, when we had the admissions or the positivity rate that we did, we were only seeing a couple hundred or even a couple thousand on our worst day positive, where now it's in the 5 digits for positivity rate, new positives every day. So with that volume, we're just seeing much more, even though it is much more transmissible, which is why we're seeing the increased number of total positives. Yes, you have a lower risk of being hospitalized. However, if you shift that number up so high, if you go from 100 positives with a 10% rate of being hospitalization to 10,000 people positive with a 1%, rate of positive or risk of being hospitalized, the number just shifts dramatically. So we are seeing across the entire state over hospitalization rates, we're way over in terms of where we should be for capacity management. And the recent DPH data that came out that goes to the healthcare community from like the physician standpoint, say we have no bed availability, like none. So the idea, if you are sick and have a heart attack, the beds are there, but we are literally running on fumes. And that's the real honest truth of where things are right now.
And what we know, right, from all of our data is that the hospitalizations lag. So that's a couple weeks even behind what we're looking at now in terms of our cases. So it's going, even if we're looking at, we could be near peak, right? Which some guesses are that we're maybe, right? Hospitalizations are going to be 2 to 3 weeks on average, right behind, and ICU sometimes even a little behind that. So it is going to get worse for y'all, Katie, and thank you for all you're doing.
Thank you. And we are seeing more children who are testing positive, who are symptomatic. Thankfully, they have mild symptoms if they're vaccinated. And, most of them are doing very well and recovering. But it's very scary to see, this is the first time in 2 years that we've had children be something we're really worried about now. And thinking about how viruses mutate, Omicron obviously is much more transmissible. So you have less time to exposure to actually get it, which many people who've had Omicron were like, I don't know how I got it, and unfortunately, we are seeing it spread not only among people in the community, but those who are exposed from a healthcare setting, across the state, that many people who are in public health and community health or working in a hospital are now testing positive themselves because of just increased exposure to so many people who have it. It's something that I wish we would peak, but based off of the data we're seeing, as of right now, our numbers have not dropped. And I hope that it happens over the next week. I can't imagine what it would look like if this goes on for longer. Like our previous peaks, which have been much slower to come down and have really been kind of like a slow mountain. So I'm hopeful that will happen. And the good news is that I am seeing a lot more people get vaccinated who never had any interest in it. And those who are COVID recovering, I do still recommend getting vaccinated. And that's, I think, an educational pearl that we all should really be aware of, that if you are exposed to COVID previously and you had a COVID in the last year, there is a very high chance you can get it again. It does not discriminate. And if you are getting it again, I am seeing that's when I literally had this conversation today about someone, well, I had it last year, how am I hospitalized with it again? And they're unvaccinated. They didn't think they could get it again. And that's really, I think, what we're seeing as this mutates is that the risk of reinfection has gone up as well too.
Thanks.
And
for
I would
sharing.
argue this surge is unlike anything we've seen before, which really does add the value, I shouldn't say value, it adds data to support that this is unlike any of the surges we've seen before and that this really is a crisis.
All right, so if we choose to take a vote on declaring a public health emergency, Tammy, do you have language, like, I know you've talked to Jesse about how that is done, but do we have specific language that we need to use?
I don't know about specific. I've seen some of the language in the other declarations and also in the town's declaration, which we're still operating under the original state of emergency that Mary McNally, the town manager, posted. But some of the language that I was using for potential other mandates really is based off the fact that we're seeing unprecedented numbers. This week is, even last week was unprecedented. And I can't imagine that next week is going to look much better. Based off of that, I would say.
So do we need to motion to vote? Okay. Or do we just vote because it was already on the agenda?
We still need a motion, right? So we need a motion to declare a public health emergency and a second on that motion, and then we do the vote.
Correct.
I can make a motion to declare a public health emergency for the town of East Longmeadow, given the COVID surge to crisis level.
And I can second that motion.
Oh, great. All right, so we are going to take a roll call vote. So Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
Great. Okay. So that is the item first thing. So the second item then is a vote to enact an emergency indoor mask mandate effective immediately for the town of East Longmeadow, which is different than the longer standing indoor mask mandate. So this would be an emergency one covering the next, 8 days, I believe, Tammy?
Well, it could be just replaced
Okay.
on the 8th day by the next by that one. But I'm trying to, okay, just Jesse and I talked about it. Because we're declaring an emergency,
Mhm.
we can we could say immediately or we could say tomorrow. It doesn't have to be effective immediately. It could be effective tomorrow or midnight tomorrow, say. And then post in the paper that it has taken place and sort of replaced with the one with beginning date, end date.
Okay.
But we could put an end date on the first one as well. I don't know if I hope I explained that right.
The second one's basically just more official. It's posted in the paper. But the first one covers it. If someone had an objection to declaring an emergency, then you would go with the next one. So the one that's posted in the paper and everything.
Okay, perfect. And I do want to shout out to literally anyone who's watching, because the vast majority of people in our community are masking. We have seen some data come out about the types of masks, and obviously encouraging folks to access the best type of mask that they can, knowing that, right, cloth mask is worse than the surgical mask, which is worse than the, KN95 and those kinds of things. But certainly recognizing not everybody has access to everything, although they are much more easy to purchase now on things like Amazon. And so also here's a question, I guess, for our health department folks. Do we have access to masks? I know we have lots of the 3-ply. Do we have access to any better masks as well that we could?
We have some,
Okay.
but maybe 300.
Okay.
About that.
Mhm.
For more of the public facing departments in town, library, whatnot, we've been focusing on giving it to them, seeing as they have the most exposure to the public.
That's perfect. And then, so and then also, I think recommendation that we along with maybe messaging, if we do enact the mask mandate, about proper mask wearing. We're pandemic fatigue so bad, right? And I think we can all understand that like wearing it down here, or, you know, so just some positive reinforcement, I think, for accurate mask wearing would be awesome as well.
And the way I like to think about it too is the virus lives in your nose. Think about where you go when you get a test. So the mask should cover where the test goes, because that's where the virus lives. So, you know, if you think about above your nose, below your mouth, you're good. And obviously we recognize when we talk or we move, it moves, just bump back up. And that's it.
Yep, really thinking about positive messaging with it. Yeah. So,
Yeah, absolutely. You can definitely put together some messaging.
okay. Any questions, any discussion other than now I think we kind of have a good idea from Tammy and Alex about the difference between the indoor or the emergency mask mandate and the longer standing mask mandate. Okay, do we want to do a motion to vote on that?
Did you guys want to decide an end date before you make that motion to include it in the motion?
So now for the emergency one, do we need to do that end date? Because once the other one supersedes it, wouldn't it take over for it?
I would say that we put an end date on both of them.
Okay.
And I honestly would suggest going with Desi's date for their mask mandate of February 28th.
I agree.
Yeah.
And then obviously if our positivity rate goes down below 3 or 4,
We
you know,
can
2 to
rescind.
3, yeah, then we can obviously have an earlier meeting and address that and kind of talk about rescinding.
Okay. Sure.
So are we doing the end date as the same, or the end date for the emergency one when if we choose to vote, right? I'm saying if we choose to vote on the regular one to go through the end of February, does the emergency one just get overruled? I don't know if I quite understand.
I think
How we
it gets
do an end
it
date.
gets overruled. The first one really doesn't have that beginning posting date in a way. It's whatever we decide tonight, if it's immediately or if it's tomorrow at midnight, or how is it usually like 12:01 a.m.
Mm,
So I have a question. Could it be tonight at 12:01 a.m.? So it would be officially starting tomorrow, or do we have to give 24-hour notice?
We can say immediately, but I think maybe for the purposes of getting the information out,
Mhm.
it would
Yeah.
help that if it's so Friday morning at 12:01 a.m.
mhm.
That way we can get the information out to everybody as well as we can tomorrow, while continuing to get that information out over.
And then
the
people
next
can
week.
prepare like within the community and within the businesses and all that as well too.
Mhm.
Yeah, I would hate to see somebody leave their house tomorrow morning to go do something.
And not be
I'm thinking go to the
prepared.
gym for their health,
Yeah,
right? And
it's
not
just,
be able to
yeah,
go
being
in.
fair.
Mhm.
Yep.
Yeah,
I
and
agree.
last time some of our businesses did complain that they didn't have enough time to prepare, print out signs, stuff like
Right.
that. So giving them a little bit of time can help with the compliance.
So then I can make a motion that effective Friday at 12:01 a.m., we have an emergency mask mandate for indoor masking in the city of East Longmeadow that is mandated. Did I do that the words right? I think.
An indoor mask mandate.
Indoor
Um,
mask, emergency indoor
indoor-
mask mandate.
Yeah.
An emergency indoor mask mandate effective Friday, January 14th at 12:01 a.m. in the state or city of East Longmeadow.
For public indoor spaces, right?
Yes. I didn't want to forget any of the words. It's stressful.
Did you
Okay,
want to
and I
put a
can
little
second that
ending,
motion.
a little?
Oh, and the end date
Ending.
would be, and I motioned that the end date would be February 28th, 2022. And we would reevaluate if our positivity rate dropped below a certain range over the next month and a half. And we could have an emergency meeting to rescind it if we needed to.
Okay.
The only thing about the wording is you said city of East Longmeadow, it's town of
They
East
were
We're
a town.
Okay, I'll redo it. I can do this. I can practice. Okay. So I motion effective January 14th at 12:01 a.m. for the town of East Longmeadow to have an indoor mask mandate for an emergency state, because we declared a state of emergency that will go in effect until February 28th, 2022. And could be rescinded early if our positivity rates drop below a certain range, and we'll have an emergency meeting.
I second that motion.
Okay. Alex, Tammy, we're good? We got
And
the language
vote?
good? Before we roll call, I just want to make sure we're all set with the language. on
Do we
the
need to say
motion.
all indoor spaces?
Oh, public.
Public.
All
spaces.
public, all
indoor.
public
Public.
indoor spaces. Do I
Okay.
need to say it again? No, okay.
I think you guys
Okay.
know what you're voting on.
Okay. So roll call vote, Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
Great. All right. Thank you. Okay. Third thing on the agenda is to enact the indoor mask mandate. So this would be the one that is published in the newspaper effective January 20th, which would be next Thursday, 2022, with the same end date. I would suggest the February 28th, 2022. This would cover the same spaces. So public, indoor public spaces. And we'll let Katie deal with a barking dog.
Yeah, sorry.
Yep.
So
We're all
that is
doing the
the
same
date that the
thing.
reminder comes out.
Okay. Any discussion on this or anything that we need to do differently on this, Alex and Tammy?
That I know of.
Okay. Are we ready to vote, ladies?
So, well, actually, now that I'm thinking about it, so if we post it in the paper on Thursday, the 20th, would that be that we would be saying that Friday, the 21st at 12:01 a.m.?
Yeah.
Mm,
Mhm.
Right. Makes sense.
Okay.
It's fine.
And as long as that doesn't get screwed with the agenda, because the agenda is printed with January 20th. So if we have to do January 20th at 11:59 p.m., we can do that too.
Well, so technically the posting is about notifying the public after you've approved something.
Mhm.
So it's not necessarily about that's the date that it can start. It's just notifying the public within that time period and putting it in a public posted place. So we could say that on that date it's official.
I just want to make sure that what's in the agenda that we say we're voting on is what we're actually voting on. So if it needs to be the night of January 20th, that we can do that as well.
I
I mean, also, I'm not sure whether or not it's absolutely necessary to specify a time. I've seen plenty of mask mandates without a time of day. If you just specify that it's Thursday.
The 20th should be fine. Okay.
Yeah.
Other discussion, other questions? Other things we need to be aware of?
Do we need to motion again for that too, or can we just vote? We have to, okay, I can do that. Seeing as I've got the wording down now. I motion that we enact an indoor mask mandate for public spaces in the town of East Longmeadow to go into effect January 20th, 2022, to be published in our local newspaper
With the end date,
with the end date of February 28th of 2022.
or if
Or
we-
sooner if our positivity rate drops and we can reassess and have an emergency meeting.
Good job.
I'm sweating.
I second the motion.
Okay, and we will do a vote. Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
Okay, all right. You got it. You made it through, Katie. Next item on the agenda, any new business we need to bring up tonight other than these things?
How are we doing? Oh, I was just gonna ask how we are doing with the garbage pickup. I know we talked about that. You know, is there anything we just want to make sure our community is aware of? So that way we can make sure everyone's aware of what the situation is and things like that. Even though it's kind of old business, it's kind of new business too.
They did give us an updated schedule. It's a little varied. I don't have it in front of me. Alex, do you have it?
I know it. Yeah. So they were behind, obviously, because they have a lot of drivers out due to COVID, and then they have some truck issues that are delayed because of parts, because of shipping issues, and then the snow day last Friday also put them behind. So they're basically a day and a half to 2 days behind on route. So right now they're picking up tomorrow. Tomorrow's Thursday. They're picking up Tuesday, the rest of Tuesday's route tomorrow morning, and then they'll be doing Wednesday's route the remainder of the day. Friday will be the rest of Wednesday's route that they don't get to in the morning, and then Thursday's route. And then Saturday will be whatever's left for Thursday route and all Friday's route with hopefully 6 trucks. So we've been in communications with them a lot and just trying to really work with them and be understanding so that they can protect their staff and also get everyone's trash picked up as well.
Great. Thank you so much for that. That's really helpful, I think.
And trying to post everything on Facebook or Code Red, any update we get, because we understand it's frustrating. So.
Alex, there's a trash page apparently now on Facebook. If you're, make sure it goes there too.
I'm not interested in joining those groups or posting on them, but I encourage people to share our posts, our official posts. I'm just more worried about misinformation on those sites because Republic only has essential dispatch in Chicopee, but you might not get that dispatch. You might get somewhere in South Carolina. You might get somewhere not local at all that doesn't know what's going on. So if people call that line, they're not going to necessarily get the correct information. So the best place to really get the right information is on our Facebook page, our website, and or we do a notification on the new Code Red system. So.
And is that what we're getting like when we get, so I got a phone call and a text message at the same time, and that's that Code Red system?
Yes, it used to be the robocall system. That now no longer exists. So if you were a part of the robocall system before, I don't know when the system took place, I think about a month ago now, you have to re-sign up. So that link is on the town website, but people can also call us. I'm more than happy to give people the link to sign up for that. It's also on our Facebook page, and you have to select all the different options to get town hall closures, trash information, anything DPW related. So it is a new system. It's not the old robocall system. People do have to re-sign up for it.
And if people
your
submit,
center is helping their members get signed up.
and if people submit their census information, is that automatically enrolled them, or do they have to enroll separately?
I think it's really only based off of the phone numbers that are in that are listed, and then you have to.
Yeah, I haven't seen a new census. Does it have a question to sign up for the Code Red on it? Does anybody know?
I didn't see that. I just filled out my census and mailed it in a few days ago, and I did not see that on there.
Yeah, I didn't see it either, but I wasn't sure if it was just automatically done for us.
That would be a good idea to add something like that, but.
All right.
I've asked for to put a button, an easy click button. I'm not sure whether or not they're going to entertain the idea, but I think it would be easier because if you go to other towns' websites, there's a much more visual, easier way to sign up for whatever their version of the robocall is. The test kits, hopefully we'll have them in 7 to 10 days. It's taken a bit of time, but hopefully we'll be getting test kits in 7 to 10 days. They're more than likely going to be the ones that people are familiar with, the iHeart kits. So the two test kits in one box. Sorry. Still haven't cleared out this thing.
It can last a while.
Yeah. And then
And
the governor had announced that 26 million rapid tests were going to the schools. So we're kind of talking about which test kits will go. So seeing as those test kits will more than likely go towards the students and their families, we'll probably aim more towards people who, are needed for being close contacts, our older community, people with symptoms. I mean, we're not going to have the amounts that they had in the larger cities that were given the free test kits. So. And then there also was the information that was put out about the digital vaccine card that will be available to everybody. So that's great. I mean, I feel like I'm getting so many phone calls of people who don't have their card, and I know I've photocopied mine and my family's and put them in basically every purse that I have. And it's most new. I mean, I know we only met a week ago, so.
All right. Any old business? I think that sort of segued from new business into old business, but thank you for the updates. Alex, thanks for the update on the trash. And it's hard, we know, during winter too. So you get winter and you layer on a ton of people being out. So we appreciate everybody being patient. It is hard to have the trash out there, but it'll get done. And thank you for Alex and Tammy and your staff as well, because I know you're handling a lot of calls with a lot of different things. So we appreciate you and everything that you're doing. Next meeting, we're still slated for next week, correct?
Is it the 20th?
I have the
thought-
18th.
I have the 18th too.
Do we need to do that still? We've had 2 meetings in 2 weeks.
Can we push that one out a little bit?
Yeah.
Because I know we're
about 4 weeks from now. So I think that's the
Yeah.
week of the 9th. Or the
Okay.
I'm opening my calendar. Hold on.
Now, Rebecca, I know your classes were supposed to start. Does Wednesday nights work for you now?
Yeah, Tuesday is going to be the new day. So any other day is fine.
I can do the 9th if that works.
Yeah, that works for, it should work for me. Is 6 good for folks?
Yeah.
Okay.
Good
And I
time.
think that'll be good. That'll give us, whatever 4 weeks of data. I think we'll really be able to see a picture at that point that we would not be able to see next week.
Yeah,
I really hope so too.
positive, hopefully in a right
We call
trend.
that negative in my house. My husband used to send me to work last year and say, having a negative day.
Ah, yeah. Good vibes, hopefully good vibes.
Yes. Trending in a good direction.
I
There
hope
you
so.
go.
I hope so.
So too.
My last day on the COVID floor is on Sunday, so I'm hopeful that I will see some changes by then. I'm hoping,
Mhm.
I don't want it to go
Gotta
the
have
other.
hope.
Yeah.
Yeah, you gotta have hope, always.
Yep. So, and thank you to our community, because so many of you are doing the right thing. I've gotten folks talking to me, right, and saying, we appreciate it. Businesses are saying, thanks for doing, doing this. There's a lot of folks out there who really are working really hard and trying to keep themselves and their families safe. And so we appreciate that from everyone. Okay. Do we have a motion to adjourn?
I motion to adjourn.
I can second that motion. I have to take the vote. Christine Johnston, aye. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right. Thank you so much. Meeting adjourned. And we will see everyone on the 9th. And Tammy and Alex, reach out if you need anything in the meantime, please.
Stay healthy, everyone. All right. Bye.
Be well, be safe. Night.